In healthy vasculature, blood flow transports nutrients and oxygen to surrounding tissues. However, when blood flow is interrupted, these life-giving nutrients are cut off. Subsequent tissue death occurs, resulting in lost function of the tissue. When this occurs in the heart, cell death creates an area of necrosed tissue called an infarct. This damaged tissue is later replaced with a fibrotic scar. This process is called a myocardial infarction, or more commonly, a heart attack. Cardiac disease is responsible for 1 out of every 3 deaths in America, of which stroke, coronary heart disease, and cardiac arrest are responsible. Heart attacks are the principal result of coronary heart disease, and they occur once every 40 seconds in America. 37.5% of the population suffer from heart disease, of which 51% are male and 48% are female. Risk factors for the disease include nutrition, smoking, and obesity. The worldwide prevalence of obesity has doubled over the past 40 years. At a cellular level, damage-associated molecular patterns are released from necrosed tissues upon reestablishment of blood flow. These damps then cause infiltration of circulating innate immune effector cells, specifically macrophages. Macrophages respond to these damps, specifically ATP, IL-25, IL-33, and TSLP, by releasing granules, which have cytotoxic and inflammatory effects. They also transcribe inflammatory cytokines such as interferon beta, TNF-alpha, and IL-1. These inflammatory factors exacerbate tissue damage, increasing the infarct site. They also increase infiltration of other leukocytes, specifically T lymphocytes. T lymphocytes respond differently to damps. Damps cause T lymphocytes to become polarized to a regulatory phenotype. This phenotype is characterized by secretion of immunosuppressive cytokines, such as IL-10, TGF-beta, and IL-2. These immunosuppressive cytokines directly target macrophages and switch them to a pro-wound healing phenotype. This results in reduced inflammation, stopping infarct growth. Our proposed advance encapsulates CCL22, a chemoattractant for regulatory T cells, within PLGA microspheres that are then suspended in a hydrogel. The hydrogel is then injected into the pericardium near the site of the infarct. The microparticles release CCL22 over time, attracting regulatory T cells and speeding up the healing process. This ultimately results in a lower infarct size and a lower fibrotic scar.